We've all had a sprained ankle at some point in our life. You step off of the ledge wrong, or you slide in a second and jam your foot, or you get tackled the wrong way going around the end. You or your child, or both of you, have had a sprained ankle. Well, today Keith May from Children's Healthcare of Atlanta is back, and he's going to talk with us about the basics of the sprained ankle, what it is, what it means, and how to treat it. It's a great show, and it's right here on Clubhouse Gas. Keith, thank you so much for joining us.
Absolutely.
We really appreciate you coming back.
My pleasure.
We're talking about sprained ankles. Everybody's had a sprained ankle. We'll start off by asking you, is a sprained ankle and a strained ankle the same thing, or is there a difference?
Very big difference, and I think that's a common mistake you hear. A lot of people use the terms interchangeably, and they're different. You strain a muscle and you sprain a joint.
Okay.
So if you hear people say, I pulled my hamstring, so the medical word for it is you strained your hamstring.
Right.
And you sprain your ankle, or you sprain your thumb.
If you're spraining the joint, what is actually is something being concussed?
Essentially, it's like a stretching of the ligament. So ligaments connect bone to bones.
Right.
And you usually have put the ligament on such a force that it's pulled. And you can have varying degrees without being too technical. You can have just a stretching, you can have partial tearing, you can have complete rupture. And so it's like different continuum of like severity.
What's the difference in a high ankle sprain and a low ankle sprain?
High ankle sprain, different structures. So like a high ankle sprain would be something more up in this part, and a low ankle sprain would be more down here.
How do you treat a sprained ankle?
There's a good acronym for it. It's PRISEM, P-R-I-S-E-M. P stands for protection, so you want to kind of protect the area. You can wear a brace, you can wear an immobilizer, that sort of thing. The R is rest. A lot of times you'll hear people say relative rest, meaning that if you do sprain your ankle and you're involved in a sport, you can still attend practices, you can still be studying film, you can be learning plays, that sort of thing, without being totally shut down. You throw the I in for ice. Ice is a great thing to control pain, control swelling. Then you have compression. You want to have compression on the joint that's sprained to help keep the blood flow down, get the swelling out of there. You've got elevation, which is a great tool to just prop that leg up, help encourage swelling to get out of the joint. And then you've got medication, which is the M. So you can, pain management, that sort of thing, anti-inflammatories.
How often do you ice?
Typically you do 15, 20 minutes on, an hour off, and you can do it as much as you want.
Do you just take an ice bag and put it on it, or was my sports trainer a sadist? Because he made me put my foot in a 5-gallon bucket that was full of ice.
You can do both, it just depends.
What do you have them do? What is the best way to go?
It's usually hard to do an ice bath unless you're like in a training room, like in a collegiate or high school setting that's got access to a big bucket and ice and all that sort of thing. It's probably easier just to use an ice bag.
Big bucket for my foot.
Yeah. Or mine. And and it's easy too. You can use a bag of frozen vegetables out of the freezer. If for some reason you don't have access to ice, or whatever, you can just throw a bag of frozen vegetables on there. It does the same thing.
What about heat? Do you ever get into heat?
You don't want to use heat on a new injury. Heat's going to make dilate tissues, make more blood flow to the area, and could actually make the swelling worse.
So if you were icing and heating at the same time, you would be just defeating yourself.
Right. Exactly. You don't introduce heat into a new injury till several days down the road.
All right. If you think your kid has a sprained ankle, you're a dad, you've had sprained ankles before, you know what it is, it's turning purple, or it's a little bit of swelling, you can't walk on it, should you still take him to the doctor and get an x-ray?
If you're in doubt, absolutely. I mean, I think if there's ever a point in your mind where you're just not sure and you're just not comfortable with it, take them, get an x-ray. There's no harm in it. And then also that ankle sprain that's not getting better, I think is worth getting an x-ray as well. Because sometimes fractures, can hide themselves and act like
What would you call that period of time of it's not getting any, where you should be able to tell that it's getting significantly better?
I mean, you look for little things like, is it continuing to swell? Is the pain not going down? Are they unable to weight bear? Are they unable to walk? And does that not get better? A basic just run-of-the-mill ankle sprain usually gets better in about a week.
Right.
So you can look in that kind of time frame to kind of see where you're at.
Last question. Is a sprained ankle a progressive injury? Like if you sprain your ankle, you get in the treatment that you're talking about, the PRISEM, and you bring the person back too early, can they get a more severe sprained ankle?
I think that if you don't manage it correctly, it could probably set you up to re-injure it,
Right.
if you're not back to where you were at the starting position. And I think if you're unable to protect yourself, you know, as an example, if you're not ready to participate, you could get a worse injury just because everything's not functioning like it should. Is it a guarantee? No.
Not a worse injury on that ankle, but maybe somewhere else.
Correct.
Well, that makes perfect sense. Well, Keith, thank you so much for
Absolutely.
coming in again. We'd
My
love
pleasure.
to have you back.
Sure.
That's going to do it for us today. Some great information there from Keith May, and we'll see you right back here next time for another great edition of Clubhouse Gas.